Spence Stein.
Hi, my name is Sophia Emmanuel. I'm a licensed cosmetologist and certified trichologist. Today, I'm going to be discussing the benefits of using the NeoGenesis hair thickening serum with my special guest, Steve McGee. Steve, how are you today?
Good, Sophia. Hi, everybody.
Yeah, so we've been doing these lives, these different lives for a few months now, and we basically started with one client with 3 case studies with different types of hair loss and different types of therapies, also incorporating the NeoGenesis hair thickening serum. The first time we did it, we just showcased the before. We didn't showcase any after photos. It was just day 0, right? And do we have those slides of our first case study number 1? Yeah, so this is case study number 1. And this young lady was dealing with some traction alopecia. And you can see she had traction alopecia in the back of her scalp at the very nape of her neck. And by day 60, which was 2 months later, she actually started to grow her hair a lot more than she had before, to the point where her braids were able to stay to the base of her neck without falling. So that's one thing that I noticed about the NeoGenesis hair thickening serum, is that she was able to get more length in a short space of time, in about 2 months. So we were able to see that. Now we're looking at day 120 using the NeoGenesis hair thickening serum, and she has made even more progress. You can look at day 0 and you can see where she started, how the sides of her hair was very bare. And then at day 60, she started to make major improvements in that area. Now, by day 120, you might notice that it does look like it's a little bare, and that's only because she has the braids attached in those areas where she does have some hair growth. So one of the things that I do recommend to patients or to clients that are using braids as a style is to make sure that they're not braiding those really delicate parts of the scalp. And if they are, that they can use the NeoGenesis hair thickening serum to kind of nourish that area to help with any prevention of hair loss during this time. So we're also going to listen to a testimonial by her at this time, just talking about her overall use of the product and what she feels about the product so far. So let's go ahead and listen.
Definitely, I will say that the areas that were more scarce, I see the budding hair more than before. I see, especially like the difference in what month is this? The last month to this month, from October to early December, I could see the areas where it's very light, that the hair is budding.
Things with this product, with this particular client, is that also her widow's peak grew in a lot during this time as well. In the front, where her widow's peak was, it was very thin, very sparse. Now she actually has some hair peeking through in that area as well. So one of the things that I've been noticing about the serum is that it also encourages growth in those areas where there may be like slow to no growth if you have follicles. So definitely she's been seeing results with this product so far, and we're very excited. She's so happy because she's tried other things on the market and she hasn't gotten much results. So she's definitely happy so far with the results, and she tells everybody about it. So yeah, it's really exciting for her. Yep. So now we're going to go ahead and look at case study number 2. So this is case study number 2. Now, this client had a different type of hair loss from the first case study. This type of hair loss is called alopecia areata. And what happens with the alopecia areata is that you don't necessarily lose hair follicles, but what you will notice is that sometimes your hair just grows in very slow, very thin. Sometimes it doesn't grow at all. So she's been dealing with this particular type of hair loss for a couple of years now. And what we have noticed, if you go back to the first slide of the back, is that she has been able to get significant growth from day 0 even to day 60. You can see just with 2 months of using the product that she got some growth in that area. And then as we go to day 120, you can see even more growth in that area. So now where she can pull her hair up into a ponytail, and it's not as thin, it's not as bald as it was in that back area of the scalp. And she can wear a higher ponytail without feeling self-conscious. So that's also some benefits for her in that area of her head as well. And we have a testimonial by her as well that we're going to listen to right now.
As Sophia knows, I used to use like a hair fiber to cover up whatever. I haven't used it in a couple of months now.
Right.
Like when I would go to her, I'd say, okay, I had to wash it out or something before she took pictures or so she could, really see. But now I don't do that. I don't have to use it anymore. I feel comfortable without having to put any kind of fiber to cover up bald spots now. Yep.
Right. Study that I noticed is that the client also was able to grow more hair in the front of her scalp as well. So the sides, as you can see from day 0 where she started, which we did showcase in our first video, up until day 120, she has made significant progress in this area. So this particular type of hair loss she was dealing with in the front is a little bit different than what she's dealing with in the back. This one is called androgenetic alopecia, and it's a more common type of hair loss that affects the temples, the crown of the scalp, and sometimes for women, the bang area, that little front area, you'll just notice like it's very thin, it's very fine. And this has been able to help thicken up her hair using the serum so far. So we've seen many benefits. Another benefit she noticed was less shedding. So she's not getting as much shedding as she was getting prior to using the serum, and that's also a benefit. So she's been able to retain length and fullness from day 0 all the way up to this point. So do you have any questions so far, Steve, about any of these case studies and the progress they've made so far?
The psychological profile for both of these first 2 case studies and the third, just listening to our second case study where she was talking about not needing to put the fiber in her hair, and it may have been a little bit difficult to hear on that audio track. You might just kind of feed that back, and then what she was saying about that, and then where is she emotionally? What's her emotional state and the emotional state of that first case study as well? Seeing where their hair has gotten compared to what had happened for them previously.
Yeah, that's a great question. So with the hair fiber, she basically was using that to camouflage her hair loss, or basically maybe she might wear hats, or she might try to just find some type of hairstyle that she could wear to cover up her hair loss. So basically what she was saying is that she no longer has to use those fibers to cover up those areas of thinness anymore. So she's less self-conscious about wearing her own hair. Because what you find is that when women or people are experiencing hair loss, what a lot of times what they'll do is they'll go get hair extensions or a wig, which there's nothing wrong with using those things to camouflage your hair loss. But if you're a person that really wants to wear your own hair, it can be even more stressful coming to terms with using a wig, because it can be seen as something that's negative if you have hair loss, because then you might be thinking to yourself, well, this is the last straw. My hair's never going to grow back. I'm never going to get it fully recovered. So for her, wearing a wig meant that her hair loss was more severe, more permanent, and that really stressed her out, and she wasn't ready to do that yet. So she was using fibers instead to cover up those areas of thinning. And now she's noticed she doesn't have to do that as much anymore. She doesn't have to use the fibers at all to cover up those areas. So it's definitely been a benefit for her. So she's less stressed about her hair at this point because of that. And she's feeling more confident wearing it out in different hairstyles rather than having to pull it up into some type of ponytail or bun, or wearing some kind of head covering for that purpose.
And I think what's so great about the work that you're doing, and we're so excited and proud to be a part of who you are and what you're bringing to the African American community. We were recently in attendance at the Integrative Dermatology Symposium. And obviously, skin care is, foremost on their practices. But the number one skin concern at this Integrative Dermatology Symposium was actually hair loss.
Right. Yes.
So hair loss is significant on the psychology of both men and women, but especially women.
Yes.
Would you say?
I was just about to say that. Yeah, but I actually, even if you want to say on the opposite is that there's a lot of men that reach out to me all the time that are looking for help as well, especially in the African American community. There's a lot of men who grow their hair out naturally as well, and they want to be able to wear their hair in an afro, a healthy afro, or whether it be braids or locks, different hairstyles. That's part of our culture, and maybe they cannot because they have some form of hair loss. So it definitely being able to offer this product to both men and women of the culture is definitely a benefit as well. So yes, I'm very happy to be able to offer this to them. And I will also say that a lot of clients have noticed, many of the clients using this product now have also noticed less irritation of the scalp, which is also another benefit that I don't speak about enough about the NeoGenesis serum, is that clients have been noticing less itching and less irritation because it also does heal the tissue. It heals the skin. So in the process of doing that, you're finding that people are getting less itchy scalp, which is also another added benefit of using this product. So yeah, it has many benefits, more than one.
Well, that particular benefit that you're mentioning, I'm so glad that you're seeing that in your observational studies as well. Chemo patients, which is another segment of the population that's so important to serve. Chemo patients frequently suffer hair loss, but that irritation, it's their hair follicle dying that is causing pain to the scalp. And, they've got enough going on if they're on chemotherapy to, have not only the loss of the hair, but the irritation, the pain that can go with it. Yeah, it's significant. I'm glad you're addressing that issue as well.
And it's also something that if they discuss with their doctor, maybe they can use as prevention. Maybe it can prolong it can prevent some of the hair loss as well. So it can be an added benefit for that purpose as well.
We've seen both helping to prevent as much hair loss and also helping to regrow that hair much more quickly to get back to precancerous stages and that health and that quality of life. Yeah, help on both ends for sure.
Yes. And I had one client who didn't want to participate in the study, but she was using the serum and she did get results. She's also a surviving cancer patient, and she was able to get really good results using the NeoGenesis serum, but she didn't want to be part of the study, which is understandable. But she definitely loves the product and the benefits as well. So yeah.
Well, I'm glad you told me that story because I mean, cancer patients are very, very near and dear to our heart. We love helping them. So I'm just glad to hear that you were able to help her through that.
Yes, definitely. Yes. So now you ready to go to the last case study, which is case study 3?
Yeah.
Okay, so let's look at some slides from case study 3. Okay, so case study 3, again, this is another popular type of hair loss. Again, it's the androgenetic alopecia. And again, we showcased in our first video where we started with this hair loss. Basically, this is the androgenetic alopecia. And it usually, like I said before, it affects the temple areas of the scalp, the crown of the head, and also this front area right here for women. And sometimes you will also get a lot of shedding, right? So the hair just doesn't anchor onto the follicle. And what happens is that you get a lot of excessive shedding all around the scalp. So now in day 60, we did see some really great results from day 0, as you could see, which is just 2 months, right? So we got really good results in that 2-month time period. And then as we get to even closer to now, to day 120, we can see even greater results in that area where her hairline just almost doesn't even look like it's has hair loss anymore on that one side. Now, this is also in the front of her head, right? So you can see at day 0, her widow's peak is very thin. And as we go down to day 60 and day 120, it's definitely filled in a lot more than the first time.
Sophia, this is amazing.
Yes, it is. She's been getting really good results. And again, it's a combination of therapies that we're using. So in addition to using the NeoGenesis serum, many of the clients are also using laser therapy. And they're also using hair supplements, depending on what type of hair loss they're dealing with. So there's a combination of different things that we've been doing to their scalp to get their hair back to health. Now, also, we have a testimonial from case study number 3 that we're going to listen to.
The way the hair feels, and it does feel healthier now. Also, the last time we spoke, we talked about the diminishing type of result of shedding, and I would say it has diminished, it has decreased.
definitely has decreased, and that was something that case study number 3 was dealing with severely because she had low iron. She had very low iron, and she was dealing with a lot of shedding. On top of having the androgenetic alopecia, it was just her hair was just coming out in clumps, a lot of hair constantly shedding. And she noticed by, I would say by 3 months, that's when she started to notice less shedding, and her hair just felt healthier. It was more vibrant. It was fuller. And she was able to retain length. Those are some of the things that she's been able to stress to me that was important for her to notice, was that she didn't shed as much. She was able to retain her length, and that her hair just felt healthier when she, touched it. So that was very important for her. And she's been able to get those results so far.
So, Sophia, in addition to the hair health, and my recollection on this particular case study was that she also had and still has significant life stresses from multiple sources. But in addition to the hair health, what are you seeing much in terms of the scalp health improving?
Yes.
And can you tell?
Yes, so definitely, if you look at these slides right here, you can see this is the same case study from case study number 3, her scalp. So this is the middle of her scalp, and you could kind of see where she has at day 0, it's very irritated, it's very red, and it's also a lot of buildup on her skin, right? A lot of buildup on her scalp. That's just a sign of like inflammation, which tends to show up again with androgenetic alopecia. And then you could see by day 60, a lot of that clears up. It's not so white anymore, and it's not so irritated. It's not so red. It's not so swollen. Now, as we get to day 120, you can see a major difference even with the color of her scalp. You can actually see the real color of her skin. You don't see that clogged buildup on her skin or her scalp anymore. So that is also another benefit of using this product, is that it also reduces irritation when you feel it, and also you can see the difference as well. And that's clear from day 0 all the way up to day 120. So again, that's the proof that it's actually healing the skin, healing the tissue as you use it, which is going to give you a longer overall treatment that's going to benefit your hair and your scalp as well. So you're getting basically a 2-for-1 when you use this product.
So now, I know we talked about this before, but it's worth asking you again. Can you consult people from afar, or do you need people to come into your treatment room to look at their scalp directly? And how can people reach you and get help from you?
Right. So yes, I could definitely consult with you. If you don't live in New York State, I could do a virtual consultation. That's fine. Yes, I'm open to doing that. And you can reach me through my website at crownworthy.com, or you can also reach out to me at Sophia Knows Hair on Instagram. Those are the 2 best ways to reach me. If you go to my website, you can just fill out a form, and I'll get that email, or you can go to at Sophia Knows Hair on Instagram and send me a direct message, and I'll see that as well. Those are the best ways to reach me at this time.
And
Yes.
do you have any New Year's wishes coming into 2024? I mean, I know you expressly want to serve the African American community,
Yes.
those higher Fitzpatrick.
Yes. I do. I want to serve the African American community, but just anyone in general who wants to come in for hair loss or hair problems, I'm willing to serve and help and provide any information that's beneficial to getting their hair healthy again. But definitely, I would like to spread the word more about just hair loss prevention and the treatments that are available in my community for my people. And I'm open to doing anyone. So yes, I do serve a lot of African American people, but I'm open to working with anyone who wants to come in for hair loss and scalp problems. So yes.
And I would just also remind the viewers that if they didn't get to see the first video where we're looking at the early stage, this is what we're going to begin to work with our case studies. You shared so much knowledge in that video about just trichology in general, and those particular hair conditions. I love in our next video to maybe revisit some more of that. There's a lot of really good education that you can give on just the different forms of alopecia. As an example, we've got case studies on 3 forms and some overlap, but it'd be great to hear next time a little bit more about some of the other forms of hair loss that you see in your clinic, and what you can do for those as well.
Yeah, and one that's really near and dear to my heart is the central centrifugal cicatricial alopecia. It's a very long name. Try saying that 3 times. But it's CCCA, right? So that's the one that really causes scarring of the hair follicle. And it's really important for people to know that if they're suffering with that type of hair loss, that early treatment is better. So if you notice a small little bald spot that doesn't have any hair in it and it just looks smooth and shiny, you really want to go into like a trichologist or a dermatologist to have that looked at, to have that diagnosed, because you really want to start treating that right away before it turns into a permanent scar and then it starts to spread and you're not able to reverse that. So it's very important with the scarring alopecias. And anytime you feel any burning, any tingling, any itching that's in one particular area of your scalp, particularly the center of the scalp, you really want to go in to be diagnosed, to find out what is causing that, to really get a head start on preventing further hair loss if it has started. So that's one thing that I would like to work more on for 2024 is finding or really helping women or men who are dealing with the cicatricial alopecias, the scarring alopecias, because those are very hard to treat because they're not sometimes, depending on when you catch it, it's not reversible, right? So if we catch it in time, we can prevent further hair loss or permanent hair loss.
Good point. I'm glad you brought that up. Yeah, you're doing amazing work, and I hope people hear you and come to you in droves because there's so many people that I know you can help.
Yes. And one other thing too is that and in the future and next year we will be showcasing some case studies with cicatricial alopecias because we know that is something that a lot of people do suffer with, and there's not enough information or case studies that are being done on it because female pattern hair loss or androgenetic alopecia is like very popular. It's the most common type of hair loss and it has the most treatments available. But a lot of the other hair loss, such as the cicatricial ones, because they're harder to treat, there's not a lot of information. There's a lot of information on there, but there's not a lot of case studies showcasing what can help and what can't help. So it will be very beneficial to this audience who's dealing with any kind of scarring alopecia to see what results they can get, if any, using this product. So I'm interested in doing that. I'm excited about that as well.
And we saw somewhat of an example of the scarring, at least the scar tissue with this third case study, right?
Yes, we did. Yes, a little bit. She's showing more signs of the irritation part of it,
Okay.
but she's not really having a lot of scarring per se, in the sense of her scalp, but she does get a lot of irritation in that area. So it could be something that is starting up. It's going to happen but she has a NeoGenesis now to kind of like help, counteract any of that.
Okay. Okay. Good.
Yes.
Well, excited to continue forward.
Yes, we are. 2004, we'll be doing more. So I'm excited. And I wanted to just thank the audience for, spending time with us today and taking the time to listen to our live, and just look forward to our next video that will be in another 2 months, where we'll be showcasing the last part of this series with these case studies. And then we'll be starting our new one shortly after that. So thank you guys so much for tuning in, and we'll see you soon.
Thanks, Sophia.
Steve.
Thanks, everybody.
All right. Okay. Bye.
Bye now.
Bye.